Welcome to Madison Health's postpartum discharge instruction video. Before going home, we here at Madison Health would like to provide some guidance about how to care for yourself and your infant from the time you deliver your baby to about 6 to 12 weeks after delivery. Vaginal bleeding. It is normal to have vaginal bleeding after delivery. During the first week, the amount and appearance is often similar to a period. After the next few weeks, it will gradually decrease to a dry, yellow-brown discharge. For most women, bleeding stops completely by 4 to 6 weeks after delivery, but can vary. Watch for any changes in your flow, such as a sudden increase in volume. Soaking a pad an hour is too much bleeding. A change in color, such as green. Passing large blood clots. If you pass a blood clot that is larger than an egg size, contact your healthcare provider and be seen that day. Uterine cramping is a normal thing, especially while breastfeeding. Motrin, other known as ibuprofen, is the medication of choice to help with cramping. This is the uterus getting back down to its normal size. You may experience stronger cramping if you've had other deliveries. Keep the perineal area clean and dry. Use medicated pads and pain-relieving sprays and creams as directed. If you've had an episiotomy or tear and/or C-section, check the area for signs of infection until you are healed. Check for redness, swelling, pain, fluid or blood coming from the cut or tear, warmth, pus, or bad smell. Use your peri bottle instead of wiping to clean the perineum area after you use the bathroom. Pat the area dry. To relieve pain caused by an episiotomy, a tear, or hemorrhoids, take a warm sitz bath 2 to 3 times a day. In a sitz bath, the warm water should only come up to your hips. Lactation will cover breast care. During breastfeeding, you may have uterine contractions every time you breastfeed for up to several weeks after delivery. This helps your uterus return to its normal size. Right after delivery, you are susceptible for a UTI. Please watch for signs of infection such as frequency, urgency, burning with urination, which is not uncommon, especially if you've had an episiotomy or tear, and a low-grade fever. Kegel exercises are very important to do because it helps strengthen the pelvic floor right after having a baby. No sexual intercourse for 6 weeks. It is possible to get pregnant and ovulate even if you do not have a period and are breastfeeding. Talk to your healthcare provider about methods of birth control or family planning at your 6-week postpartum follow-up appointment. Take over-the-counter prescription medications and stool softeners to help ease bowel movements as told by your healthcare provider. Review all previous and current prescriptions to check for possible transfer into breast milk. Risks of taking prescription opioids. Anyone who takes opioids can be at risk for addiction, accidental overdose, or death. Chances of opioid overdose increase when opioids are taken alone, mixed with other substances, taken in larger amounts, and are restarted at the same dose after taking a break from using them. Ways to use opioids safely. Keep your provider informed. Inform them of any history of substance abuse. All patients treated with opioids for pain require careful monitoring by their healthcare provider for signs of misuse and addiction and determine when meds are no longer needed. Follow directions carefully. Opioids may result in side effects, which includes drowsiness, constipation, and depressed breathing, depending on the amount taken. Take the lowest dose needed to control your pain and never more than prescribed. Reduce the risk of drug interactions. Don't mix opioids with alcohol, antihistamines such as Benadryl or Claritin, barbiturates, benzodiazepines. Combining any of these substances with opioids can lead to life-threatening respiratory depression. Please talk to your provider on more drug interactions. Gradually return to your normal activities. Rest as much as possible. Nap while your baby is sleeping. Drink plenty of fluid. To help prevent or relieve constipation, eat high-fiber foods every day. Increase calorie intake by 300 to 500 calories a day while breastfeeding. Examples are a granola bar. Baby blues are a normal thing right after delivery. You had a sudden release of hormones, and while your body adjusts and tries to regulate, you may have some extreme blues where you are crying, and you may have some extreme highs. If after 2 weeks you are still having those feelings and you are now noticing you don't want to hold your infant anymore, you're no longer having joy in spending time with your family, or you have no interest in the things you used to enjoy, make an appointment right away to see if you are experiencing postpartum depression. If your infant is crying and you have gone through the cry plan that your nurse will provide to you, place your infant in a safe place in a separate room for 15 minutes and let your infant cry it out. This allows for a reset and allows you to breathe through a stressful time. It provides that time out that you may need. After 15 minutes, get your infant and try the cry plan again. When to seek medical care? A 911 call would be pain in your chest, obstruction in your breathing or shortness of breath, seizures, thoughts of harming yourself or others. When to be seen by the provider that day? If you notice your leg is red, swollen, painful, and hot to the touch, these could be signs of a blood clot. Before placing your infant into the tub, make sure you check the water with your wrist that is the closest to your baby's skin. Make sure that you do not place your baby alone on a couch or a chair. Avoid latex and balloons. Balloons are a choking hazard. Make sure to place all firearms in a safe. No co-sleeping with your infant. Make sure your smoke and carbon monoxide detectors have their batteries and are placed properly. If you have pets, make sure to introduce your baby slowly to them. Make sure to schedule all of your follow-up appointments. Everyone should have a 6-week postpartum follow-up. Your provider may want an earlier appointment, but keep your 6-week follow-up. Thank you for choosing Madison Health for your hospital needs.